Begin with an overview of the data. Our 7-day average of cases is about 95,000 per day. The 7-day average of hospital admissions is approximately 8,500 per day. And the 7-day average of daily deaths is 1,300 per day. When I spoke with you last Friday, we covered CDC's recommendations and our decision to offer Pfizer vaccine booster doses to specific communities. For those who received a Pfizer primary series and who are at least 6 months after their second dose, the following Americans are eligible for a booster. Those over the age of 65, those 18 and older who have an underlying medical condition, such as asthma, diabetes, or obesity, and those 18 and older who live or work in a high-risk setting like a hospital, school, grocery store, long-term care facility, or a homeless shelter. Although protection against hospitalization and death remains quite high, we are starting to see these populations have some decreased protection against SARS-CoV-2 infection, likely due to both waning and to the Delta variant. Many of the people in these groups were some of the first people in the country to receive their vaccine. They also include people who, because of where they work or live, may have high rates of exposure to COVID-19. And they are the same people who remain essential to our current COVID-19 response, like healthcare workers and teachers, as well as those in frontline jobs. Their well-being is essential to keeping hospitals staffed, schools open, and many other essential parts of society functioning. Both FDA and CDC reviewed data on the safety of booster shots, including for those who are 18 to 64. Today, we're releasing a new publication in the MMWR that shows that COVID-19 vaccine booster doses so far are well tolerated. This report includes some of the data of our early experience with third doses that FDA and CDC reviewed when they made their recommendations about boosters. The frequency and type of side effects were similar to those seen after the second vaccine doses and were mostly mild or moderate and short-lived. If you are eligible for a vaccine booster and you have questions, I encourage you to go to vaccines.gov, talk with your healthcare provider, pharmacist, or a health professional about your current risk for COVID-19, the benefit of a vaccine booster dose, and the safety of receiving an additional dose. We will continue to evaluate data as it becomes available in real time and with urgency, and update our recommendations to make sure that all of those at risk have the protection they need. This includes those who received the Moderna and J&J vaccines as their primary vaccine, and also those younger Americans who are not currently eligible for a booster dose. As I said last week, this action is an initial step related to booster shots. It will not distract us from our most important focus, to get as many people as possible vaccinated with a primary series. We remain steadfast in our effort to vaccinate as many people as possible and to continue our fight against COVID-19. Those who are unvaccinated remain the most vulnerable to infection, severe disease, hospitalization, and currently there are over 70 million eligible Americans who remain unvaccinated. The best way to protect everyone, including those who are not yet eligible to be vaccinated, such as our children less than 12, is to vaccinate as many eligible people as possible. My closing ask to you is, if you have not been vaccinated, please do so. If your neighbor, family member, or friend has not yet been vaccinated, please assist in providing them the resources to get there. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next couple of minutes is make the point of the importance of vaccination from somewhat of a different standpoint than we usually do. My father was 8 years old in 1918 when the historic influenza pandemic occurred. We all know about that. I remember him telling me, particularly after I had made a decision to go to medical school, about the frustration and concern that all of his relatives and friends were going through back then, and how he lost cousins and uncles, namely people who were generally young. And the one point that he made is that they were very frustrated because not only did they not know what the etiologic agent was, they had very, very little pharmacological intervention. Namely, they did not have any vaccine. So what we decided to do, my colleagues and I, next slide, please, is that David Morans, Jeff Taubenberger, and I, in May and then again in August of this year, wrote in the American Journal of Public Health 2 articles, the 2-part article, which we called A Centenary Tale of 2 Pandemics, in which we looked at the 1918 influenza pandemic and the COVID-19 pandemic from multiple different parameters, which we called variables. Next slide. And if you look at the slide and compare one against the other, in public health tools, there's one thing there that sticks out so boldly. Back then, they had crude early bacterial vaccines that likely never would have gotten approved by the regulatory and public health authorities today. But they did not know what the etiologic agent was, whereas today we have a highly specific, highly effective, and very safe vaccine. They did things somewhat similar. They did closures, they did isolation, they did social distancing, but what we have is other things like sophisticated ventilation, HEPA, airflow. They had the same print media, but now we have social media. They had some supportive care, but they didn't have ICUs, critical care, mechanical ventilation, ECMO. They didn't have antimicrobials. We do. We have antivirals. They had the same problem with quack and unproven remedies that we have today. But the thing that really stands out in all of this was the issue of a safe and effective vaccine. Next slide. And so if you look now, I've entitled this slide, Vaccinations in the United States, Much Accomplished, but also much to do. Jeff gave you some numbers about those in this country with at least 1 dose, and the numbers fall under the much accomplished. If you look at people who are fully vaccinated, almost 184 million, about 2.78 and now counting people who've received an additional booster dose. But we've done very well. But in fact, there are still, as we've all mentioned over and over again, there are approximately 70 million people in this country who have not been vaccinated. If you go back and look at the very, very many deaths that occurred back in 1918, the overwhelming majority of those deaths would have been avoided if back then, when my father was 8 years old, they had a vaccine, but they didn't. We do. And if we look at the people already who have died, the overwhelming majority of the people who've died from COVID-19 were people who are unvaccinated. And so we have something my father did not have. Let us use it. Last slide. And that gets back to what we say all the time. After Delta became the most common variant, fully vaccinated people had a 5 times less risk of infection and more than a 10 times less risk of hospitalization and deaths. Message again, get vaccinated. Back to you, Jeff.
Well, thank you, doctors. Let's open it up for